My name is Thao Nguyen,
And I'm Hannah Reynolds.
and today we're going to do our video about
Cultural diversity, which affects nurses and patients in the healthcare.
And this affects patients if they have a language barrier, like they cannot speak English or have a different cultural view, which nurses can be culturally competent by being open to their views or different medicine relief practices.
And it affects the nurses because they can't understand what the patient is saying and they can't provide the proper care that the patients deserve, and they don't understand the different views and practices that these patients go through.
So therefore, we're going to provide you different scenarios in the healthcare facility where you might encounter, and we hope you enjoy it. Have a foreign patient who does not speak English. She has abdominal pain, and the nurse is going to come in and check in to try to assess her pain level.
Ma'am, where is your pain? Can you tell me where your pain is hurting right now? So it hurts in your side and your head? Can you tell me how bad it hurts on a scale of 0 to 10, with 0 being the no pain and 10 being the worst pain? I need to get a translator in here.
And then we come in with a translator to help. Hello, I'm the translator.
I have this patient here who seems to be in pain, but when I ask her where it's at and what her pain level is, she just points and I don't know what she's saying. Can you help translate, please?
What ethnicity is she?
She's Vietnamese.
Okay, good. I can speak Vietnamese.
Okay.
Sao có thấy nó đau?
Ở ngay bụng, ở ngay đầu, đau quá.
Một cho 10 nó là cái gì?
8.
Tại sao bị đau vậy?
Không biết.
Okay, the patient says she has a pain level of 8 and she doesn't know why.
Okay, well we need to assess this right away and get some pain meds for her.
Yes. Okay.
This is a cultural conflict because the nurse and the patient cannot understand each other because of the different languages that they speak. And this is a problem for the patient because she can't get the help for her pain that she needs because the nurse can't understand what she's saying. And it's a problem for the nurse because since she doesn't understand the patient, she can't assess her and help with what she needs right away.
We have a couple in the hospital room practicing an alternate medicine relief called Gai Goi, which is popular in the Asian culture. It may look abusive, as we see in these pictures right here, where the patient or person gets a coin and rubs it on their back, and it looks really like red marks, like they have been abused, but they have not been abused. It is just a form of alternate medicine relief that's popular in Asian cultures. So now we'll look in the scene and see how the patient and the nurse interact.
Hello, I was just checking in to see how you're doing today. So I was just going to first come and listen to your lung sounds. Oh my gosh, why are you so red right here? What are you doing?
Now we get Vietnamese culture, and then some kind of to release for different sickness, and then to help get them feel better. But I don't know how to explain. I may talk to my daughter, she understand more. She will explain to you what will happen.
Is this the medication that you're using?
Yeah, some kind like, but we call the kula, but yes, we can use that some kind medication.
Okay, well I'm just going to need to take this to the pharmacy to make sure that this medication will not interact with her other medications that we're giving to her. So I'll just take this down. Okay.
Right, that's good that the nurse took the medication, because we want to see if the medication interacts. And it looks like this. So the patient and the nurse interaction. The nurse was just worried about the patient's condition because it can look like the patient is being abused when they really are not. And this is a form of alternate medicine relief.
I'm a Jewish female in the hospital in the ICU unit in critical condition, and the doctor has ordered that I be put on life support. And this is a machine that basically does my breathing and everything else for me so that I can stay alive. And now we're going to go into the scene and see how the patient and nurse interaction.
Hello, Miss Hannah. I'm being your nurse today, Thao. So how are you feeling today?
I'm feeling pretty good.
That's good. Alright, I'm going to check your vitals, and the doctor ordered for life support, okay?
Life support?
Mm-hmm. This will help manage your breathing and all your vitals to make sure that you have good vital signs.
I don't want to be put on life support.
Why is that?
Because I don't believe in that.
Why do you not believe in it?
Because it goes against my religious views that I have.
What are your religious views?
Judaism and Jewish culture, we don't believe in being put on life support.
Okay. So then, as we can see, the nurses and the patient interaction, the patient decided not to go on life support, which was the patient's own decisions, and us as nurses, we have to agree what the patient desires or what he or she wants for best for the cultural views of the patient needs. So us as nurses, we have to respect that and go along with their views to make sure that they have a good time at the hospital.
We have an Amish female patient who has been at the medical center for 2 days now, and she has a very critical heart condition, and we need to give her a heart valve that the doctor has ordered. And so we're going to go into the patient's room, and also we need to collect her health insurance because we haven't gotten a chance to do that yet because of her critical condition. Rebecca, I've come in today to collect your health insurance because you've been here for 2 days and we haven't gotten that on file yet.
What's health insurance?
It's basically where you have a health insurance agency, and they pay for the majority of your health care costs while you're here at the hospital, and then you either have nothing to pay or just a small fee to pay when you leave here.
I'm sorry, ma'am. I don't have health insurance.
Okay, well that's fine. Well, I'm just going to prep everything up because we're going to send you down to the emergency room because the doctor wants to, right now you have a critical heart condition, and right now you have a heart valve that's not opening and closing like it should. So the doctor wants to perform a surgery and replace your heart valve with a pig's heart.
A what?
A pig's heart. We're going to go take a pig's heart and we'll cut it open, and then we'll take the valve from the pig's heart and then put it into your heart.
Oh no, ma'am, I can't do that.
Why is that?
Because we can't accept anything from an animal. It's because of my views. I'm Amish.
Okay. All right. Well, I respect that.
Okay, thank you, ma'am. In this scenario, we have a patient who cannot maintain eye contact because in their Hispanic culture, maintaining eye contact means disapproval, and it means unrespect to authority. To have respect for authority, the patient will not maintain eye contact, while the American culture, maintaining eye contact means that they're attentive, they're listening. While this may confuse some people at the hospital setting because of different cultural beliefs such as that, and personal space, because as doctors or nurses, we come in, we may be too close in their personal space, so some people need like at least 3 feet or more between their personal space, and some cultures may not speak without a man present. So today we will see a scenario acting out these things. Hello, Miss Hannah. We're going to do a health history history today for you, okay? So can you please tell me your name?
Space.
The space? Oh, I'm sorry. Is this a cultural thing?
Sí.
Okay. Alright. So is this comfortable for you?
Sí.
Okay. So can you tell me your past medical history?
No.
Why not?
Yo quiero husband.
The husband.
Sí.
Oh, you want your husband? Can you maintain eye contact with me?
No.
No. Why is that?
That's culture.
A culture. So then we see that's a cultural conflict. So the patient shoved as a sign as to move further away. So as nurses, we have to look at the patient and see how they react. And if they're having pain, you can see in their face and how they're moving. So we need to make the patient feel comfortable, as we need to look at the patient and see how they're acting. And since the patient was verbalizing for her husband to come, so then we would know to get the husband and to help her.
So the lesson that's learned today is that nurses cannot interfere in patients' decision. The patients have their own right to make their own decisions when it's regarding their health. Just because patients might have different views than what the nurse believes in doesn't mean that they can get emotionally involved and make the patient's decisions.
For examples of these include abortion. We can't tell the patient not to do that, or whatever their concerns are, because it's their patient's choice. Or another scenario would be a lesbian or gay couple. We can't come in and freak out and be like, where's the father? Because it's their choice to have adoption, and we have to respect what they believe. And to be culturally competent nurse, we have to be open to their views and provide the best optimal care for our patients. So we hope you enjoyed our video and learned many new things, and
Thanks for watching.
thanks for watching. Hope we all have a successful nursing career.
Bye.
Bye.